Organizational Evaluation and Strategic Planning, Banner Health Organization. Introduction. Healthcare organizations face multiple challenges in managing public health issues due to numerous constraints. Therefore, they may need organizational change to create a flawless corporate culture and draft a strategic plan that will inform future choices regarding the management of public health issues. This change management essay will perform an organizational evaluation of Banner Health Organization. Banner Health needs a more coherent approach toward addressing critical health concerns despite a comparatively well-thought-out framework for operating in the U.S. healthcare industry. By conducting a health organization evaluation and shifting the focus toward enhancing organizational readiness for handling community health issues, one will empower nurses at Banner Health to gain new skills and improve the quality of care. Banner Health Organization. Banner Health is a non-profit organization that has been focusing on the delivery of healthcare services to American citizens. Located in Phoenix, Arizona, Banner Health has expanded to cater to the needs of people across the United States. The organization is still growing and planning to extend its services to an even greater area. Simultaneously, Banner Health promotes lifelong learning in nurses and students, providing additional options for education to healthcare staff members and learners. However, since Banner Health has not yet integrated the concept of innovation into its services, it may need further alterations to meet the current quality standards in healthcare. Health Organization Evaluation, Organizational Readiness. To address public health concerns on the statewide level, Banner services will require a profound understanding of current problems faced within the American community. However, one should keep in mind that assessing readiness requires performing a detailed evaluation of numerous facets of the organization's functioning. These include the management of key operations, the promotion of innovative thinking, and the communication strategy used for establishing a rapport with the community. Applying the tool suggested by Deering, one will realize that Banner Health has developed an impressive readiness for catering to the needs of American patients, yet the further focus on innovative approaches toward health needs management and the increase in the availability of services will be needed. Healthcare Organization Strategic Plan. Network Growth. Expanding the network of Banner Health and increasing the influence that the organization has on the local community and American healthcare, in general, has to be regarded as one of the goals of the organization. To increase the extent of its impact, Banner Health will introduce a network in which it will collaborate with other healthcare organizations to produce a greater effect and focus on interdisciplinary work as the main tool for handling complex public health concerns. By adopting a multidisciplinary framework for managing public health problems, Banner Health will develop a tool for performing a complex assessment of people's health status, evaluation of key health problems, and location of the available solutions. Nurse staffing and resource management. The problem of low staffing rates is likely to be observed in the Banner Health setting as soon as the new approach toward public health management is introduced and the number of nurses' responsibilities rises. To counteract the problem, managers will have to focus on recruiting and educating new staff members, which can be achieved by launching an education program for undergraduates and potential applicants. The program will target students who are going to become APNs and APRNs to create the foundation for effective care across the United States. The proposed measure will cause an increase in the number of competent and knowledgeable staff members, who will provide patients with proper care and tend to their needs with diligence. Thus, the problem of staffing may be resolved with a focus on nurse education and their education. To produce the required results and manage some of the current public health concerns, such as obesity and CVD, Banner Health should update its approach toward resource management. The use of sustainable practices should be incorporated into organizational management techniques. Patient satisfaction. While ensuring quality and compliance with nursing guidelines are critical components of effective care, increasing the levels of patient satisfaction should also be deemed as important. As long as people are comfortable with the level of care and the quality of communication with nurses, they can focus on self-education and learning crucial aspects of self-care. With the increase in health awareness across American communities, a range of current public health concerns will be resolved or, at the very least, managed with more positive outcomes. the extent of patient satisfaction will rise with the improvement of patient-nurse dialogue, which the Banner Health Organization can facilitate by introducing a digital system of communication. Potential issues in organizational culture. At present, the levels of performance at Banner Health can be described as moderately good, yet there is an evident lack of nurses in the clinical environment. The shortage of nursing staff can be attributed to problems in the management of nurses' needs, including a challenging workplace environment, disrupted work-life balance, and the absence of rewards or positive reinforcement of any kind. At Banner Health, the situation is far from being drastic, yet putting nurses under increased strain may entail difficulties in communication between the staff and managers. Therefore, a certain amount of resistance toward changes is expected to be observed, especially given the nature of anticipated changes and the predictable increase in the range of responsibilities to which nurses will be assigned. The issue of reluctance among nurses as one of the most problematic potential scenarios in the organizational culture can be addressed by introducing incentives and shaping the corporate culture toward a more patient-oriented one. Strategic plan implementation. Since the current problem concerning the provision of proper healthcare services and the management of public health issues stems primarily from the quality management strategy, the integration of an improved quality management model should be deemed essential. The EFQM model as the tool for promoting organizational excellence in the environment of a healthcare facility is likely to serve as a perfect support for transitioning to a new model of functioning. Since the proposed framework is rooted in the notion of quality enhancement, it will become a cornerstone for implementing innovation-driven healthcare and the promotion of continuous improvement. To support the selected framework, one may need to incorporate the BSC model into the promotion of positive change, since the BSC tool will encourage organizational change. Thus, the efficacy of care is expected to rise in the selected area. Conclusion. With the focus on the promotion of improvements and the integration of innovative treatment and diagnostic methods, Banner Health will be capable of supporting a vast range of patients. Therefore, the suggested model of care should be integrated firmly into the current approach toward managing the needs of vulnerable groups. As a result, Banner Health will improve its performance and embrace a wider range of public health issues, improving access to care and communication with target audiences.